when Rogers was at his zenith, at his height, there was only one other kind of therapy. And nowadays, there are 50 or 60, you name it. They grew in the 20th century, in the 1900s. But the only one that Rogers had to cope with, and incidentally he learned it at first, was psychoanalytic therapy. Then there was another growing counseling, which wasn't therapeutic at all. But at the University of Minnesota, they were developing vocational counseling and helping students to chart their way through school in appropriate ways in terms of what they wanted to learn, what they wanted to study. But Rogers didn't like some of the aspects of psychoanalytic therapy. I think he felt it was too intrusive and too authoritarian. Now, this was his idea, not everybody would agree with him. But what he did, there was a young psychoanalyst, Otto Rank, who was the colleague of Freud. His ideas were more experiential, to hear the patient and stay close to the patient. And this happened, Rogers heard about that. He knew only how to do psychoanalytically oriented, but he heard about Otto Rank and was taken with the idea, and so Rogers began to construct a form of therapy that was more native to him, that was, in his judgment, less authoritarian, more giving, more attentive to the client, and he called it non-directive therapy at first, because this was a dialectic process. He was saying, my therapy is not authoritarian. So he declared it and said non-directive, but that wasn't a very good title. That's what therapy was not. And he finally got to a better title, which was client-centered therapy. That had a special meaning. I mean, it sounds client-centered therapy. You can't argue exactly. Most therapies ought to be client-centered. But he meant something rather special, and that is that he would listen to the phenomenology, to the way of thinking that the client was presenting, so that he paid attention to the internal structure of the client and try to really understand what the client was experiencing and how she or he was experiencing it, and then hear that out and help them understand it better. That was really the essence